Well, welcome back. And I am so excited because I have a guest that we've had before, and it's Monica Oviedo. Monica came to us when she was in nursing school. So we're really excited to have her. And it's just amazing to know more about what her journey is and where she's going from here. So, Monica, thank you for being with us today. And I really appreciate you coming back to tell us exactly where you are today with nursing. I know last time we spoke, you were in nursing school. So, first, give us a little bit of your background for those that haven't seen you in the other episode. And what are your favorite things to do? Why you chose nursing? And why do you think it's important for us to have more Latinas going to nursing?
Well, thank you for having me back. It's always a wonderful time speaking to you. So right now, I just finished nursing school back in August, so I'm still a fresh new nurse. Um, I enjoy traveling. That hasn't changed since last time we talked, so that's still something. um, let's see. I think the last time we talked was about 3 years ago.
Yes.
Back then, I was in a different nursing program, and then we can talk about it later on as we go. Uh, but yeah, that's where I'm at right now. I'm a nurse. I'm about to take the NCLEX next week, and
Fantastic.
as new nurses, I think it's important to have Latino nurses come on board, especially now that the Latino population in the U.S. is growing. So we
Hmm.
need more representation in the healthcare field for sure.
Yeah, definitely. And I guess tell everyone that you're where you're from also, that you're from.
Oh yeah, so I'm originally from Mexico, a little city called San Luis Potosi. That's I grew up there until the age of 7, and I came here to Detroit, yeah, at 8, 7, and I've been here since then. So,
That's great. That's great. And so far, I know that you went through nursing and now you're going to have your exam next week, you said?
yes,
Or
yep.
next year? Oh, fantastic. So what has it been like as far as the program right now for from nursing school to graduating? And congratulations on that. That's fantastic. And so, what is your next steps here after you graduate?
Okay, so I graduated from Chamberlain College of Nursing. It
Mhm.
was an accelerated program just because I have a previous degree from Wayne State. So that program was about 2.5 years. Like I said, it was accelerated. Those classes were 8 weeks. Um, we were done and then on to the next one. We didn't really get breaks there. I think throughout the whole year, maybe we only got 2 1 week breaks. So it was pretty fast paced, but I enjoyed the program so far. I would definitely recommend it. And now that I graduated, I actually work over at Royal Oak in the emergency department.
At Beaumont?
Um, yep, because I was already working there as an emergency tech. That was a position that they called it. And I just transferred over to the RN role. And that's where I'm at. And that's where I'm going to do my graduate residency nursing program. And it's basically a year long program where I'm paired up with a preceptor to kind of just guide me and train me essentially.
Hmm. So is that what you're going to need to be prayer to be a registered nurse to get your certification, or what is it that you
Um,
what
yep.
steps do you need?
So I guess let me backtrack. So the next step after graduating from nursing school, you have to take the NCLEX, which is basically the national licensure nursing exam. Um, you go to like a specific site, and then the state will give you your license once you pass the exam. So
Okay,
it's
that's great.
very stressful. So
Well, I'm sure you'll do very good. You mentioned to me that you're in emergency right now. You're working in the emergency area of the hospital. What is that like? What's your typical day going into emergency?
yeah, so I work in the emergency department at Royal Oak. Um, right now I'm 6 a.m. to 6 p.m. So as soon as I get on shift, I get a report from the night shift nurses, and they just kind of tell me about their patients, why they're there, and any, we call it nursing interventions that we need to do for them. If they need any medications or certain procedures, MRIs, X-rays, we kind of help prepare them, get on board with that. Once we get a report, we go on the computer, just make sure that they're basically up to speed with what the doctors want from their patients. They need labs, X-rays, MRIs, that sort of thing. Typically, we have about 4 to 5 patients, but of course, it's the emergency room, so there's patients coming in and out. So you might have a patient stay discharged within the hour and get another one in that same hour. So typically, you might get throughout the day, I don't know, 10 patients under your care, but that's because they come in and out. Then we just kind of work them up, figure out why they're there, and once we figure out why the patients are there, we can determine any medications, labs that they need as well.
Wow. So, out of all that experience, what is it that you've liked the most being a nurse now that you are in the hospital?
So for me, I definitely like the emergency department. I like the fast pace. I like that there's always something new. It's never a dull moment. Definitely a lot of learning, and that's what I enjoy the most. And obviously interacting with the patients. Um, and what I enjoy the most in the emergency department is how quickly we can, for lack of a better word, like heal them or get them better in a short period of time. So you might see somebody coming in for dehydration where they're just completely lethargic, super tired, and then they might typically be there for 5, 6 hours. And then after 6 hours, they look a lot better and they're like, okay, I'm ready to go home. So yeah,
Wow,
that's
that's
the
good.
most rewarding part, getting them better.
So, with the pandemic, what was it like though? I mean, being a Latina and knowing the fact that, well, this is kind of something that's affected our community so badly. So, how was your experience with the pandemic, especially during this time and being at a hospital?
So I started over at Royal Oak 3 months after the pandemic started.
Beaumont?
Um, Back then, it was very, very stressful because there was just so many changes going on every day, pretty much by the CDC and guidelines and stuff that we needed to do. Um, I remember back then we used to see so many patients with COVID, um, and a lot of them would get admitted because they were just in pretty bad shape. They couldn't breathe. So that was a little nerve wracking, because protecting them, we also had to protect ourselves, put on our protective equipment, making sure that we had our masks, our goggles, um, and the specific area that we have in the EC, it was pretty much a closed area. Only certain people could go in there and come out, obviously to decrease the spread of the virus.
Right, right.
But as a Latino nurse, I think we did see a couple of Hispanic patients come in, and they didn't know English, so that was kind of difficult for everybody, really, all the staff. And luckily, because I was there, I was able to kind of help translate a little bit. So in that aspect, for sure, we need more nurses, Latino nurses, just to kind of help decrease the workload, or help staff in general.
Yeah.
So, and obviously, those patients that don't speak English, they deserve the same treatment as everybody else. So, because
Yeah.
oftentimes they feel like they're being left out or they don't want to speak up because they're afraid, and we definitely don't want that. So,
Yeah, especially during COVID when their families couldn't come in and you were really the only person that they could rely on, and they were probably grateful that you were there because of the language barrier, or even if they knew English, I think the comfort of another Latina in the culture and the language, to, just, relying on that comfort level must have been very nice for them, that they probably
Yeah,
didn't imagine to have, and they're just grateful. And I can't imagine other families and other hospitals where there aren't any Latina nurses, how
yeah.
horrible it
So
must have felt.
we did have a couple patients. Mm, they came in because they had COVID and they were very afraid. They're like, "Oh my gosh, what's happening? Where am I going? Why are they doing all these tests?" Like, you know, they thought they were dying. I'm like, "No, no, that's not what's happening. We're just trying to make sure that you're okay, that you're hydrated." Um,
Right.
they did have some, respiratory conditions because sometimes they might have pneumonia or something else. Then they do need to get admitted, just to keep an eye on that. But I was there as a comfort for them, telling them what was happening, where they were going. Just that reassurance makes them feel a little bit better.
That's great. Well, I'm glad you were there for them. That's really reassuring, I'm sure.
Yeah.
So you also, last time we talked about your sister and I think a cousin that were in nursing. How are they doing?
Yeah. So my sister's doing really great. She works at a doctor's office where
Okay.
they do it. I think it's like a Alzheimer's office
Oh,
where they do a
wow.
lot of really cool stuff over there. She was just recently told me that they are trying a new drug that was approved by the FDA to reduce like the severity of Alzheimer's and dementia.
That's that's
And
wonderful.
their location is the first one to try it out. So yeah, she's really excited about it.
That's great. And I think you had two cousins. Was it here or in Mexico that they're they're going to study
They're in
nursing?
Mexico,
They're Mexico. That's great. They need
but
to come here. We need them here. So that's wonderful. So, I know you went through I want to ask some questions that I know that as students, you know, did you ever consider having a mentor or looking for a mentor and when you were in nursing? And was it kind of hard not to find one that was a Latina, or how was that experience?
well, I was actually at Wayne State for a while. In it, I was in a group called Latin Amer- Latino and Latin American Studies. That was a program that they have there. So I actually had mentors there, but a
That's
lot of
great.
them they were um, students, maybe like a year above me. So I guess that was nice, but I didn't have like a Latina nurse that was already in the program to kind of help guide me. So that was a little difficult because we were all kind of trying to navigate everything kind of roughly at the same time. So I would have loved to have like a Latina nurse from the beginning to tell me, you know what, this is what you need to do. These are the steps. Don't do this, do this. It
Right.
would have saved me a really long time, but it's okay. Everybody has their own journey.
Yeah, yeah. So, I have some students looking at listening to you on this video, and some of the questions that I kind of came up with that I thought would be really that I found that they would be interested in knowing is things like the workload. So, workload at school, nursing school, what is that like and how do you prepare for it? If is it something to be unexpected, or how do you prepare for it, or how do you, keep positive moving forward with that if you see that it's overbearing possibly? What did you do?
So the workload in nursing school is definitely a lot just because there's so much content and material that we need to
Mhm.
learn.
Yeah.
Um, just imagine our body, there's so much going on in our bodies.
Yeah.
Um,
A
so it was
lot.
definitely a lot. What worked for me was I had a calendar and I divided each day pretty much on what I was going to do. One day was going to be just for studying, homework, um, studying for exams, or any research papers that I might have had as assignments. So, yeah, it was a lot. But I think it's important to keep in mind why you're doing it and don't lose sight of that focus, the dream that you have essentially. For me, what I always had was okay, the goal, I would write it on a sticky note, my name, and then BSN RN. That was kind of like a reminder, okay, that's my goal. That's where I want to get to. I want those credentials, for lack of a better word, behind my name. Um, so I think you just have to keep reminding yourself that it would be worth it in the end.
Yeah, that's fantastic. What about the professors? Now, and some professors may be different. Students might wonder, how to, some might be different maybe in the classroom versus in clinical. Did you find that experience? Did you find a difference? And how did you handle that?
Mm-hmm. So because pandemic happened, we were all online for the past 2 years almost. Uh, Obviously, each professor has their own method of teaching. Some are more to the PowerPoint, some are more, from experience. Some might tell you, okay, you need to refer to the book to kind of, you know, understand what's going on. But I think each class, you just kind of have to get a feel of what the professors are looking for and their teaching
Yeah.
method. You can't
Right.
just rely solely on the professors. You kind of have to do your own part too. Like, okay, I'm going to look at the PowerPoints, I'm going to listen to the lectures, I'm going to write my own notes. Because it's definitely a lot more time consuming. But the professors are always welcoming, so you can always ask them, if you have any questions, and they'll help you.
Yeah, that's important. Always ask questions. I think we forget to, or we're afraid to ask questions sometimes, but we should always ask questions. It's and just in life in general, always, even beyond school.
Yeah.
Um, so, what would you recommend to a student as far as preparing for their first day and clinical?
Okay. Definitely be there on time. 10, 15 minutes, just be there on time so you can figure out where you're going. Especially if you're going to a new hospital, they're pretty big. You don't know where you're going.
It's a
So just make
maze.
sure you be there. Make sure you get there on time. Make sure you have your supplies, whatever you need, like a stethoscope, scissors, um, your pen light, which is to check patients' eyes. Um, just make sure you go prepare in any paperwork that you might need. So that
That's,
helps, and make sure you drink water, a lot of water, because you will
mm,
become very dehydrated quickly. So
yeah, you'll be walking quite a lot, I imagine.
yeah.
So, should a student nurse focus on studying the reading material or and the lecture notes equally, or is one more important than the other?
So this question, if I had a mentor back then, I wish they would have told me from the beginning, okay, let's figure out your learning style. Are you more of an auditory learner, visual, or kinesthetic, which is tactile, touching things, feeling
Right.
things? I think once you figure that out, your nursing journey or education journey would be so much easier, because then you can figure out, okay, I'm more of an auditory learner. I'll spend more time listening to the lectures. Okay, I'm more of a visual. I'll look at the book or reading it. So, but at the same time, nursing school is a lot of you need to combine things, because you can't just solely focus on one thing. Because you might find that, okay, the book makes more sense than the lecture to me, and that way you can make the connections.
That's great advice, definitely. And lastly, was there anything else the students should know before committing to 2 years of nursing school?
Yeah, it's very time consuming. Just you have to go in with the mindset that nursing school, that's all it's going to be for the next 2 years. You have to be very focused. You might not have a lot of time to do what you normally do, hobbies or traveling. If you like traveling like me, you're not going to have time to do that. But also find a good support system, because that will help you get through it, whether that's family, friends, girlfriend, boyfriend, whatever. So just having that support system really helps a lot.
Yeah, I imagine especially family because they need to understand the time that it's going to be committing to going to school and of course the return on investment for not
Yeah.
just not
Yeah.
just for yourself, but also for your family, which is,
Yeah.
wonderful, I think. So that's great. So any other words of recommendation that you want to give to a student in high school that might be considering nursing?
Mm, yeah, if you are looking to go into nursing school, just let me know. I got a lot of experience in that. I went to two different nursing programs, so I know how it goes. I know how hard it is. Um, so if they need any help, I'm here. I'll be more than glad to mentor them.
That's wonderful. Well, thank you. Well, thank you so much, Monica. I think we're going to follow you as you go through your journey. I can't wait to the next one. So,
Well,
we'll have you back again. So, thank you so very much. And I
thank
think
you.
everyone's going to enjoy this. Thank you. Thank you, everyone, for joining us on Ask the Latina. We hope to see you in the next episode.